So do we ever think that healthcare will become affordable and accessible by expecting our hospitals to become cheap? Or by expecting specialist physicians to take pay cuts? I don't think so. But rather what we have to do is drive, using technology, bring technology to outpatient clinics so we can begin doing there the simplest of the things that historically required a hospital, and then use that technology to enable them to do progressively more sophisticated things, and then bring technology to doctors' offices so you can do there the simplest of the things that previously required a clinic, and then enable them to do more and more. And then technology so that in the home we can begin doing the simple things first and then more and more. And if I plotted there the professionals, we would do the same thing. So we would bring technology to primary care doctors so they can do the simplest of the things that in the past had to be delivered to a specialist. Bring technology to physicians' assistants and nurse practitioners so they can do the simplest of the things that historically had required a doctor, and so on. And so the way healthcare becomes affordable and accessible isn't by expecting the expensive ones to become cheap, but rather by enabling lower-cost venues of care and lower-cost caregivers to become progressively more capable, is the mechanism by which healthcare becomes affordable and accessible. And this problem that we face in healthcare of high cost and inaccessibility isn't at all unique to this industry. Many, many other industries have gone through this transition to affordability and accessibility, and this is the mechanism by which it is done, and it's the mechanism by which it can and must happen in healthcare. Now, every time a disruption happens, and you can think of disruption geographically as moving out to a bigger circle enabled by affordability and accessibility. There are three elements that drive that. The first one is a simplifying technology that transforms the industry's basic technical problem into something that is so simple that someone with a lot less training can solve the problem very well. Now, in computing, that simplifying technology was the microprocessor. Before that, to design the logic circuit in a mainframe or mini computer took hundreds of engineers 3 to 4 years to develop that logic circuitry. But the microprocessor made it so simple that Jobs and Wozniak could slap a computer together in a garage, and Michael Dell could design and build these machines in a dorm room. So every disruption is enabled first by a simplifying technology. That technology then has to get embedded in a new business model. Because if the technology is trapped in the high-cost business model in the center of the prior graph, it simply can't afford, it cannot impact the world in a cost-effective way. The business model enables us to take a simple solution cost-effectively to the customer. Now, if I stayed with computing, Digital Equipment Corporation, a big maker of mini and mainframe computers, had microprocessors readily at their disposal, but their business model couldn't profitably build and sell a computer for less than $50,000. And so digital got killed by this progressive decentralization of the industry. IBM had the very same microprocessors, but they went here to Florida and created a different business model down in Boca Raton that could profitably build and sell computers with 25% gross profit margins, making them by the millions, instead of mainframe computers that required 60% margins, making them by the hundreds. And because IBM coupled the simplifying technology with the business model innovation, they changed the world. Now, what is that simplifying technology, and how does it relate to pharmaceuticals? Well, this is a pattern that happens in almost every industry. At the beginning, the industry's technical problems are solved by people with deep expertise, and they solve the problems by drawing upon their intuition through trial and error. So as a good example, 70 years ago, if you needed a new organic molecule there are only about 50 people in the whole world who are good enough chemists to build these molecules, and DuPont employed almost all of them. And the process by which they would discover these molecules was one of them would mix up a few atoms in a beaker, stir it, heat it up, draw out a fiber, look at it under a microscope, go down the hall, knock on a colleague's door, and you say, "What do you think I've discovered here?" And she'd say, "Geez, I have no idea, but bring it in. Let's heat it up for 10 more minutes and see what happens." The miracle molecules that we know as nylon, Kevlar, polyester, and acetate emerged from the labs at DuPont through what was essentially an unstructured experimental trial and error process in which only the world's finest experts could engage. And those experts probably failed 400,000 times for the 4 times that they hit big home runs, but that's just the way it worked. Then, as those experts practiced their craft, patterns began to emerge. And as organic chemistry moved into a pattern recognition realm, you could begin to teach other people how to do this. There were no cookbooks yet, but you could express outcomes probabilistically based upon the different pathways that one might take. That enabled a lot of other companies to get into the industry. And then quantum theory, as it became better understood and applied, really transformed it into much more of a rules-based enterprise. Because quantum theory essentially allows you to predict in advance what kinds of molecules can and cannot be built. And if you build a molecule of a given structure, it allows you to predict what the properties of that material will be. And with that understanding of cause and effect, you can then write a piece of software that essentially allows you to type in the properties you need, and the software will help you reverse engineer the structure of a molecule that comes as close as possible to yielding the properties required. And so this is just a bit of an overstatement, but really today, you only need an MS in Chemie from an average state university and a good piece of software. You can design better molecules faster and at lower cost than could the world's experts 70 years ago. When we're done with this session, if you could remember, just stand up and turn around 360 degrees. You will be able to put your fingers or your eyes on at least 24 fibers that have proven to be an unmitigated blessing in your lives in terms of their appearance, their durability, their functionality, their flexibility, their cost. But that blessing has not come to us by replicating the expertise of DuPont scientists, but by commoditizing their expertise through scientific progress and driving it out to the periphery where many more people could competently solve these problems. Well, it turns out that in medicine, you have analogous challenges. This is kind of a simple way to describe how I have come to view it. And that is, the body has a very limited vocabulary that it can draw upon to express that something's gone wrong. And the body's vocabulary are our physical symptoms. The problem is that there just aren't enough symptoms to go around for all the diseases that exist. And so the diseases had to get together and agree to share symptoms. Well, the problem that that creates is we generally have diagnosed disease by the symptom that we can see. And when you then diagnose by symptom and apply a therapy to a patient, she might respond. You could then apply the very same therapy to another patient with the same symptom, and he won't respond. And the reason, of course, isn't that the therapy is variable, but rather we understand now, thanks to our understanding of the genome, that there are many diseases that share the same symptoms. And when you cannot diagnose the disease by cause, but only by symptom, it's impossible to have a rules-based therapy. And care there has to reside in the realm of what we called intuitive medicine.